Speak up.
Speak up.
Speak up.
Speak up.
Speak up.
Hi, I'm Dr. Anshumala, consultant gynecology. Today we speak about something which is very integral to every woman's life. The menstrual cycle or the period or the MC or the bad period is what we'd like to speak about today. So what is exactly a normal menstrual cycle? Lot of myths around it. You would say things like it should be for 5 days, 7 days. If you're not bleeding so much, maybe there's a problem with you. Every woman is unique, and a menstrual cycle is also very, very unique to each one of us. So there is no hard fast rule. It's not like you must have 4 days of bleeding. It can be from 2 days to up to 7 days. In fact, you can also have it once in every 22 days, as early as that, to once in 35 days. So it's not a hard and fast rule, and as long as you're within these parameters, you're actually having a very, very normal menstrual cycle. The other myth that I have always encountered is pain. Is it normal to have pain during periods? Is it okay to double up in pain, wanting to take medications? And the most important thing, mothers coming and telling you, don't take any medicines for the pain, just try and bear it. Well, pain is okay and normal to have during periods, but only for a day. Everyone is supposed to have some amount of pain. Uterus is a muscular organ. It's just like you were swimming suddenly and your muscle would go into a cramp because now it is suddenly doing a lot of activities. Similar to that, the uterus, when it starts its menstrual cycle and starts bleeding, there is a cramp that happens in the muscle, because of which you get this spasmodic or like a cramping pain that comes and goes, usually in the lower part of your abdomen and the back. Getting relief with one particular tablet or one particular anti-painkiller is sufficient. That means that pain is normal to you. But if your pain is extending to anything which is more than a day, going on to before the start of the period to up till the period is lasting, needing you to take multiple medications, not able to go to work, having to sometimes even faint because of pain. That's not a normal pain. It needs to be looked at very diligently. So what's the next biggest myth around menstrual cycle? Something that you hear about a lot. In fact, something which sometimes is called, that time of the period, she must be cranky because of that. Some of it may be true. You do have hormone changes that happen to you just before the onset of periods. So about a week before, your body swells up a little bit. You may find that you are a little constipated. You may have bloating feeling all around. You may have mood changes, a little bit of irritability can be present. These kind of effects are classified into what is called as premenstrual syndrome or premenstrual symptoms. These things are manageable. They are things which can be taken care of by taking supplements. There are medicines which could be taken to help reduce the bloating feeling and the constipation. Remember also, if you are someone who has a good lifestyle, so you are eating the right kind of food, exercising well, PMS reduces because the bloating sensation gets better, your salt retention capacity in the body is lesser, so you don't feel all bloated, all constipated, you're much more energetic, and the PMS does not really bother you much. The other thing which I think has become a moot point is hygiene. Which pad should you use? Is this one better than that one? How do you clean yourself? How often do you change your pad? So even if you're using a cloth, it's perfectly fine for you to use the cloth as a sanitary napkin as compared to using a regular pre-made synthetic sanitary napkin. However, it needs to be cleaned well, or it needs to be disposed of immediately. You should not use it for beyond 3 to 4 hours, be it a cloth or be it a sanitary napkin. Tampons is another thing that most people would want to use. They are known to cause a very serious illness called as toxic shock syndrome, which is basically a very severe infection which occurs if you've left the tampon inside the vagina for longer than 4 hours. So if you're using tampons, use it for a short period only. Make sure you've changed it every 3 hours and do not keep it in overnight. Definitely not a recommended thing at all. Make sure you're using, you're cleaning yourself with water every time you go to the washroom, which is a regular thing you should do. How do you clean yourself? Always clean yourself front to back, not back to front, because that does not allow contamination of the vagina, leading to other vaginal infections as well. So that's another thing you must remember to take care of. Another very sensitive topic, some of them come up and ask me. In fact, younger, I think, the people who are not very aware would say that, maybe if I have sex during periods, I actually get pregnant. It doesn't happen like that. That's absolutely untrue. In fact, it is the lining of your womb which was ready to hold a pregnancy coming out, which is what menstrual cycle is all about. That's a period when the woman is usually having some cramps, a lot of discomfort, a lot of blood flow happening around the uterus, and the area is very sore. At such point of time, indulging in sexual intercourse might be uncomfortable for the woman. However, if the woman is very, very comfortable with it and would like to go ahead, I would recommend use of a barrier, that is a condom, each time, because that just prevents infections. So, awareness and knowledge as well as educating girls about menstrual cycle is extremely important. More so when you have younger girls coming up to school, girls in rural areas, developing areas who may not have access to a lot of information about menstrual cycle. Let's not make menstrual cycle a taboo. Let's use it to empower women to in fact feel as free and as normal as possible during this period of their lives.